Welcome to Med-Surg Tutor, where I go over nursing concepts for nursing students to better understand concepts in medical surgical. This video will go over the nursing process. We will do this by using ADPIE, which are the 5 steps nurses must understand to deliver effective nursing care. So as a first-year student, it can be hard to get in the habit of thinking like a nurse, which is why understanding ADPIE is going to be useful. If you stay until the end of the video, there'll also be some practice questions that are kind of NCLEX style to practice some of the material that I go over in this video. ADPIE is an acronym we use before going into content. Try using the knowledge you already have to understand what the words mean. So before you even dive into what assessment, diagnosis, planning, intervention, evaluation is, kind of use your context clues to define those words based off what you already know, just basic definitions. The reason why I want to mention this is because as a nursing student, especially first-year nursing students or people who are just starting out in a program, you want to get in the habit of being able to think critically. So the A in ADPIE is for assessment. The goal here is to gather information. So we have subjective information and objective information. Subjective information is basically the information that the patient tells you. For example, if a patient says they're dizzy, that is subjective information. Objective information is information from data. So say you take vital signs from your patient. That blood pressure is objective information because that's data, that's a fact, which is different from subjective because that's what the patient is telling you. So how does the nurse do this in ADPIE? Patient interview, physical exam, medical history, diagnostics. So to get the subjective information, you're going to want to ask your patient questions. When did this start? When did this pain start? Things of that nature. Are you in pain? Rate the pain from 1 to 5. And then physical exam. So the emphasis on assessment is important here. Knowing how to do a HENT, knowing how to do your head to toe. When you're doing these assessments, you can gather information, and that's the point of A in assessment. Medical history and diagnostics, those are quite self-explanatory. Diagnosis, the goal here is finding out what the problem or potential problem is. And the nurse's role here is health promotion. With diagnosis, we're using the information we learned from assessment and building upon it with that diagnosis. Know what a nursing diagnosis is and how to make one. This is important, but I'll go over it in another video. For now, just know the goal of diagnosis is finding out what the problem is. After I've did my assessment on my patient and I got the subjective and objective data, I need to know where the problem, what is the source of the problem. So I'm going to give you guys an example of a diagnosis, even though I'm not going to go into detail on how to create a nursing diagnosis. I want you guys to pay attention to this example because it's different from a medical diagnosis. Nursing is its own field, and like I said before, as a first-year nursing student, it can be difficult to think like a nurse. So the example here is impaired physical mobility related to pain and decreased strength as evidenced by the inability to ambulate without assistance and verbal report of pain rated 7 through 10 during movement. Let's just keep it at that, but for the next video, we will go over how to write a nursing diagnosis. The next step in ADPIE after diagnosis is planning. The goal here is to set goal for the patients that can be measured. So sometimes we call these SMART goals, goals that are specific, measurable, achievable, relevant, and time-bound. So let me give you guys an example. The patient will ambulate 20 feet twice daily with the assistance of a walker and physical therapy support within 7 days. This goal here is specific, it's measurable, it's achievable, relevant, and time-bound. So it's specific because we said 20 feet. And it's time bound because we said within 7 days, just to pinpoint where the SMART goal acronym can come in handy here. And if you guys notice, as you go through the steps, you can see that each acronym in ADPIE is based off the last one. So we can't really plan for the patient if we haven't already diagnosed them with that problem. Intervention. Intervention, the goal here is to take action to meet goals that were set. So again, based off that last acronym, planning, before we can take action, we need to know what we're taking action for, which is the point of the diagnosis and the point of the planning. This is the part where we actually do something to help the patient. So 2 terms I want you guys to know: independent and dependent, and another one, collaborative. So 3 terms. So independent is nurse initiated, dependent requires provider orders, and collaborative is team based. So these terms are important to know because as a first year nursing student, once you understand the role of a nurse, how to think like a nurse, and what the nurse's position is in healthcare, this succeeding in medical surgical will be much more easier because you can put yourself in the mindset of the nurse. And here, intervention, you always want to document the steps that you take. Evaluation. So the goal here is to find out if what you did worked. Okay, so we have a patient, we assess the patient, we diagnose the patient. Now we're planning what to do for this patient. After we planned it, it's time to put our plans in order, which is intervention, and then finally evaluation. Did what we do work? At this point, you'll review outcomes, adjust the care plan, or continue or discontinue or modify the care plan. So this is very important because it all ties into the previous steps of ADPIE: assessing, diagnosing, planning, intervention. So based off if what we did worked or not, then we would have to go back and assess again. We would have to go back and diagnose again and plan again, and then more interventions. So the main thing I want you guys to take from this is that ADPIE it's an acronym that works in a certain order, but based off this evaluation step, you may have to go back to the A for assessing or the D for diagnosing, depending if what you did worked or not. So before we move on to the practice questions, I want to give you guys some test taking tips. So first year nursing students, these are some of the things I recommend you look out for when taking those exams for classes or even the NCLEX. So first you want to look for those keywords: priority, first, only, best, and we're going to move on to the next one so I can better explain the first one. Then we have the ABCs, the airway, breathing, circulation. When you're helping a patient and the answer choices are talking about priority, well, saving the patient's life or making sure the patient is in great condition is the priority. And we do this by making sure they have the necessities they need to actually be alive, which is airway, breathing, circulation. Then we have the Maslow's hierarchy of needs: safety, least invasive, and least restrictive. And then practice questions. I always recommend doing a ton of practice questions because these will kind of train your mind to think a way a nurse thinks and think in a critical way, which will hone your skills, not just for test taking and to excel in classes, but as well as in practice. So just keep these in mind. This slide will also show up in a variety of other videos, and I'll go more into depth about them. But if you guys already are familiar with some of the concepts on here, definitely pay attention to them when you're taking exams. So for the first practice question, during the assessment phase of the nursing process, which of the following actions should the nurse prioritize? A, identifying patient goals. B, performing a physical exam. C, documenting interventions. Or D, administering prescribed medication. So you guys can pause this to answer it, but I'm going to break the question down for those of you ready to answer it. So let's read the question again. During the assessment phase of the nursing process, which of the following actions should the nurse prioritize? So this question is asking about the assessment phase. And in the assessment phase, we know that the goal is to collect information. So based off of that, I know that I'm going to look for an answer choice that resonates with collecting information. And that answer choice is going to be B, performing a physical exam. Question number 2. What is the primary purpose of the planning phase in ADPIE? So we have A, to determine if the patient goals were achieved. B, to create individualized patient goals and interventions. C, to identify potential complications. Or D, to implement physician orders. So here it's asking us about the planning phase of ADPIE. The planning phase, we know we're using the information from the diagnosis to create a plan, essentially using the word in the word to help the patient out. So looking through these answers, the answer will be B, to create individualized patient goals and interventions. So with B, based off the diagnosis, we know how to proceed to plan to kind of work with that diagnosis and using the things we gathered from the assessment to make the diagnosis and then planning for that diagnosis. So by creating individualized patient goals and interventions, that resonates with the planning phase of ADPIE. If you guys go through the other answer choices, you can actually pick and choose which phase of ADPIE is which. So for A, to determine if the patient goals were achieved, that will be evaluation, which is why I think using practice questions is pretty cool, because you can really break the question down to kind of test your knowledge, not just by answering the question, but literally breaking the question down, each answer choice. Question 3. In the evaluation phase, the nurse determines that a patient's wound is healing slower than expected. What should the nurse do next? A, discontinue the care plan. B, notify the healthcare provider immediately. C, modify the care plan to better address the patient's need. Or D, document the findings and take no further action. I'm going to give you guys a second to read over this one. All right, so the answer is C, modify the care plan to better address the patient's needs. So this goes back to the evaluation phase. So we realize that our patient's wound is healing slower than expected. So the best thing we do at this evaluation phase is go back to planning. And when we go back to planning, we're kind of modifying things. So ADPIE is very flexible. Once you understand the basic concepts and the goal of each step in the nursing process, it's going to be easier to answer these types of questions. And it's also going to be easier to critically think in the mindset of a nurse. And then we have this final bonus question. Which of the following are subjective data gathered from the assessment phase? So we have A, patient BP is 102/60. B, nurse observes blood and patient vomit. C, patient white blood count are elevated. D, patient reports dizziness. I'm going to give you guys a second here. All right, so digesting this question, they're asking for the subjective data. Which one of these is subjective data gathered from the assessment phase? So with certain questions, you can't really get around it if you don't know the definitions. So here, knowing the definition of subjective data is really going to save you. And the answer is going to be D, patient reports dizziness. Remember guys, in the beginning of the video, subjective versus objective data. The subjective is info the patient tells you, and objective is info from the data. So D obviously says patient reports dizziness. So that's something the patient is telling you. So guys, I hope this video was helpful. This is a brand new channel kind of helping guide first year nursing students or just nursing students in general. I will be dropping another video soon about how to write a nursing diagnosis, and please like and subscribe. Thank you.